and welcome to the Reflection Show with me, Martha Anabila. If you see me wearing this, it means that we are about to tell you about the public awareness campaign that is the COVID-19 vaccination. The Martha Inspires Foundation, in partnership with the Mastercard Foundation, is implementing this project. Unfortunately, a lot of us think that COVID is over, so we are living our lives in a manner that is not safe for us. A lot of us have some kind of misconceptions about the vaccine, which is not true. There are people who are willing to take the vaccine, but they meet friends who tell them different kind of stories. I don't know the kind of stories at where you live or where you stay, but for we those at the northern region or we those here in Tamale, we'll be sharing with you some of the myths and misconceptions about the COVID-19 vaccine, and we will tell you that they are not true and give you detailed reasons why you must take the vaccine. Some of us have taken the vaccine but haven't taken the booster. Some of us have even taken the AstraZeneca, and some of us don't even know whether we have to go back for a second shot or we can just take the Johnson & Johnson. COVID-19 is still real. A lot of people are still getting infected, and if you're not careful, it can become something very serious. Let's go for a break. When we are back, my team and I give you more details about this campaign and where you can reach us anytime within the period to get vaccinated. Stay tuned. Welcome back. I'm here with a health practitioner and also with one of the project assistants for this project. They'll be telling us about the campaign and also telling us about, we've gone to the field a few times and we've seen some of the issues that are coming up, and we think that it's the right time that we bring to you this episode so that you are able to understand the scope of the campaign. You're able to understand the scope of the vaccine, because a lot of people have questions that we cannot answer at the field. So let me go straight. So I have with me here Kenny and Mr. Kadri. They are here to help us with the discussion. So let me go straight to Kenny. Kenny is one of the project assistants. So Kenny, I don't want to do that talking even though I'm the project lead, but so let me just start with Kenny. Then of course I will come in with some of the things that I want to say. Public awareness campaign. Our viewers are asking, people are asking, what is the campaign all about?
Okay, so good morning, everyone. I'm Kenny, of course. And the public awareness campaign is strictly about the COVID-19 vaccinations. So as Martha said correctly, a lot of people are scared. We've heard so many stories, so many misconceptions. And this data has gotten out. That is why the Mastercard Foundation saw it fit to partner with Martha Inspires Foundation. Let's come to the north. Let's come to Tamale. Let's see how we can help so that the people can know that, oh, COVID-19 is still there and you still need to get vaccinated. So just because you think you're fine and because they say we shouldn't wear nose masks anymore, so we are just doing anything that we want to do. But right now, it's actually coming back. It's getting worse. And it's even in the villages. Old people are dying. They don't know why. Because, there's no test kits. Nobody bothers. They keep complaining of the distance from the hospital to the communities. They can't get there. So what do? Martha Inspires and Mastercard decided, okay, let's go to the communities. Let's orient them. Let's bring them together. Let's tell them about the vaccines. Let them know that when you take it, obviously, nothing bad will happen. And your life would actually be better.
Yeah, so I just want to add something to what Kenny said about the nose mask thing. We are still encouraged to wear the nose masks as many times as possible. However, maybe as Ghanaians, our president came out and said that it's not, at first it was a law, but now it's not a law. But we are all encouraged to still wear the nose mask at all times so that we can stay safe. Now, I'll be coming back to you about the Center for Disease Control, the CDD, and a lot about Mastercard Foundation. But before we come there, I want the nurse who is on the field to tell us about some of the misconceptions that we have been hearing about the vaccine.
Okay, thank you very much. You see, as a public health officer, we are always on the ground, and a lot of people are saying things about the vaccine. The misperception and conception is that when you take the vaccine, it makes you not to conceive. People think that it have a clotting factor in the blood system,
Okay.
and a lot of people also think that when you take it, it it goes a long way to what you call cause a lot of disease in your system. Once these perceptions are going on, it goes down to the people's minds that if you take it, you get a lot of infections. Some people also say that when you take it, you get impotent, especially the men.
So
That's
they
the
are afraid to
perceptions.
get impotent.
Impotent. And others have the belief that when you are taking it as a young lady, you will not get your
Menstrual
menstruation,
flow.
menstrual flows throughout the year. And others have the perception that you will never conceive, not think of giving birth. So this myth or these beliefs are in people's mind. And a lot of people have to calm down, especially the opinion leaders. We have to get the opinion leaders, talk to them, so that they will advise what they call our people on the ground that this is not what the vaccine is going to cause. And with the public health officers or the nurses, we have to also calm down. We give health education, give effective communication. Ghana Health Service have to calm down. The SBCC have to also calm down, so that we see how we can clear this myth, how we can clear these doubts, so that a lot of people will come out and take the vaccine. COVID is still real. When you go to the hospital, we still have COVID infections. But
Wow.
because government is no more giving the updates
Yeah,
at first,
the updates.
that
Yeah.
is why people think that it's no more there. Or because government have relaxed the protocols.
Yes, yes.
That's why people
Even
think
with
that.
the nose mask, it's not at first before you enter into a bank without a nose mask, you can't go in.
Yes.
But now the protocols are relaxed.
So now I'm appealing to the authority that they should also think that a lot of people have infected with COVID-19, but because the tests are not being doing, if they were doing what you call
The
routine
test and then publicizing the numbers.
numbers, we get a lot of people who have been infected. So what I can say for now is that the misconception is too much in the system with regards to the vaccine, unless we have to advocate more
Okay.
for people to take it.
Okay, so one, it is not true that when you take the COVID-19 vaccine, you become impotent or you will not have your menstrual flow or you will not be able to conceive as a woman. These are all misconceptions about
Yes.
the vaccine. And if we do not get into the minds of people, we will be still at a place where the infections are going to increase every day,
Yes.
every day. Has these myths and misconceptions actually affected the number of people that take them? So let's look at when the vaccine came and now. Why is there a trend? Are people taking the vaccine? Has it reduced?
Yes, it has reduced. At first, when we were doing it with Ghana Health Service, anywhere you go, any community that you go, at least the numbers were not encouraging until Mastercard and Matter Foundation came in. Because of this DEVA and other things, when we go there, when we go the field, the numbers start increasing because of the awareness that you people have come
to
to
create.
create. Yes, the number have started increasing. But first, when Ghana Health Service was doing it, you go to the communities, nobody cares because there was no kind of awareness,
Awareness is like
advocacy.
just go and sit
Sit
there, come and vaccinate.
yes. So I think your impact is giving us a lot of the numbers. Now, if you look at the data, when we started with Ghana Health Service, the data was very low. But when Mastercard came,
Matter Inspice and
yes,
Mastercard
now
came in.
the number has started increasing.
Wow.
And we think that if
Continue.
if you continue like that, I think we get 90 or 80% coverage in all the
Okay.
region or Tamale.
Okay,
Yes.
okay. Kenny, take us through the campaign. What are some of the activities that people should expect us doing? Because we started the campaign already, we've got to some places. What is the campaign all about and what should people expect more about this campaign?
Okay, so what we should expect is that we are championing COVID-19 vaccinations. We need everybody, as many people as possible, to get vaccinated. And now, based on the data we've seen from internationally, so the African Center for Diseases also did a partnership with Mastercard Foundation.
Center for Disease Control.
Center for Disease Control had a partnership with Mastercard as well, and they started going to countries, Uganda, Ethiopia, Nigeria, and they made a very, very big impact.
Wow.
So they decided, okay, Ghana, let's come to Ghana. Where should we go to in Ghana? And they decided to choose Matter Inspires Foundation. Yes, thankfully. And then the campaign is all going to be about talking about the vaccinations, going to the communities, mixing with the people, finding out their ideas. There will be stories of the misconceptions and how people have been afraid about it. There will be documentation, of course. There will be social media awareness. There will be TV and radio awareness. A lot is going to be done. And we are really, really hoping. Just this, it looks like it's small, but we are going to hit way more. Ghana Health Service will be jealous.
So the Master Inspires Foundation and the Mastercard Foundation, Master Inspires Foundation in partnership with the Mastercard Foundation. Now, for me personally, I think that when we went into the communities, we went the first day, and I think for about almost an hour, the people hadn't gathered. I was like, okay, are they really going to come? But it's like the team went into the communities, posting stickers, posting things, and by the time you knew, and you see, the chiefs, I want to say a very big thank you also to the Nantong Zo Paramount Chief. He did so well. We went to meet him, and you see, I think that when the opinion leaders understand this, it makes it easier to go into the communities. And he gave us, he helped us to mobilize his people. And I think so far that has been the place we've had. Of course, we're going to more places, but I think so far that has been the community with the highest number of people that vaccinated. And they're even calling on us to come back again, that more people want to vaccinate because we are unable to cover the community. So I think that as part of the campaign, we'll be speaking to more opinion leaders. We'll be speaking to more, should I say, politicians, the everybody who matters. Because I've seen that when leaders are able to understand the concept of what you want to bring on board, it's easier for their followers to come. So assuming we went to the chief palace, and he was like, no, I won't accept this. You can't do COVID-19 vaccination in my community. It means that we can't do that in his community. But he did so well. And Charlie, it was even more than a day, but it looked like a festival. So thank you very much, His Royal Highness, for the opportunity to give us your community to come and do the campaign and the vaccination. And sure, we'll be coming back. I think this morning I had a lot of calls that we need to come back there. And so, like Kenny mentioned, we will be going to a lot of media stations, not just on the Reflection Show because it's ours. Those in Tamale, that's the northern region. Those in the northeast region and upper east and upper west will be coming there. And when we come into your community, we are coming to the radio stations, the TV stations. We are even thinking of even doing some podcasts to see people who are even who don't have access to TV and radio can also listen to. And then the Gongon Beaters too also helps us going around to be the Gongon to inform people that you must get vaccinated. So the campaign is big. The campaign is not just a one-day event or a one-week event like the Master Inspires Foundation to do. It's a campaign for 3 months from September all through to November. So in these 3 months, but after that, we are going to make it sustainable. We are still going to ask more people to get vaccinated. It doesn't mean that after 3 months, we are going to go back to our shelves and say, okay, we are done. But at the end of the day, unless we hear that there is nothing like COVID-19 in the world anymore, but as far as COVID-19 is ongoing, we are looking at the individual. Why must you get vaccinated? The impact on the community. Why should the opinion leaders get vaccinated? And also the vaccine. The vaccine is important for you as a person. So yes, Doc, let me come back to you. We have some age range of people that can vaccinate. Also, just take us through that one. Who is qualified to vaccinate?
Yes. If you look at the age groups, we have different vaccines for different age groups. If you look at Pfizer is meant for those who are up to age 16 up to 18 years.
Okay.
That is for those who are 18 to 16, 16 to 18.
16 and
Pfizer.
above. So below, like 15 below, you can't vaccinate.
No.
Okay.
Yes. So 18 and above, you can take AstraZeneca. We have Moderna. We have Sputnik V.
Hey.
And have Johnson and Johnson.
Okay.
Yes. Those who are 18 and above, that's adult age. Yes. But Pfizer is meant for 16 to 18 years. Yes.
Now, how many times should one vaccinate? I think first we heard that you have to go for the first shot, go for the second shot, and go for a booster.
Yes.
Then Johnson and Johnson came, and it's just one shot and a booster.
Yes.
So take us through, when I take the first shot, what is the time range? So let's start from AstraZeneca. That's the first one that hit Ghana.
Yes. AstraZeneca was from Germany. It was what do you call it? Meant for 2-month shot. When you take the first shot,
you wait for 2 months.
You wait for 1 month.
Okay.
And take the other shot. So when the first when the first vaccines came, it was for nurses and some security agencies. Because we were the frontline, frontline workers. So later on, other companies developed their vaccines.
Yeah.
Johnson & Johnson came, Moderna came. So now Ghana was overwhelmed with vaccines. Well, donors were giving us a lot of vaccines. So it was now time for the whole population to take. So when Johnson & Johnson came, it was one shot. That is 2-in-1. When you take it, it's meant for both the first and the second. But later on, as research goes on, they said that you have to take a booster. That will boost the system. So when you take Astra, Zeneca for the first month, you go in for second dose, and 3 months time you go in for the booster.
So if it's the first the Astra, you take the first month, you wait for 1 month, take the second dose, then after 3 months you go for the booster.
Yes.
But if it's Johnson and Johnson, you just take the one shot.
Yes.
How long do you take the booster?
3 months time.
After 3 months you take the booster.
Yes.
Okay.
So as time goes on, AstraZeneca was feeding out from the system. So a lot of research came out and said that fine. So if you take AstraZeneca for the first time and you go in for AstraZeneca for the second time, your booster, you can go in for either Moderna or Pfizer as a booster to AstraZeneca. Or if you take AstraZeneca for a first time and second time there's no AstraZeneca, you can take either Pfizer or Moderna as your second dose and wait for 3 months and take the booster. And this thing, it was going down with people. Some were willing to take the booster because it's very difficult to convince our people. You know the myth about it. So a lot of people were taking it, but the more education has to be done and more effective communication. But when we communicate effectively to the people, they'll buy into our idea. But when you just go and carry the vaccine to the field and start calling people, they will not come.
They will not come.
Effective communication has to be done, and we have to involve the opinion leaders. When you involve the opinion leader, if they see that the chief is taking the vaccine.
Yeah. I think on Saturday, our second community, when we went, I saw a man with like that chief aura, the smoke, and when he started coming, people were like, "Oh, Mba, my father is going to end." I don't know where they took on, but I think they were so happy they came around, and some were like, "Okay, because he has taken out, also take." And I feel that that's so important because our leaders, our fathers, our mentors, our role models, you need to set great examples for us. The myths and misconceptions, they're not true. If they were true, I think that people out there wouldn't have produced these things for because they care about us. And the World Health Organization will not just give us anything because there's this misconception that because we are Africans. No, it's not true. It's still the public awareness campaign here on COVID-19 vaccination. Master Inspires Foundation, in partnership with the Mastercard Foundation, is championing this campaign. Let's go for a break. When we are back, we continue.
Books by Pastor A.L. Fant. They are inspired by the Holy Spirit, simple to comprehend, relevant in application, and so lovely to read. Grab copies like Dynamics of Kingdom Influence, Dynamics of Ministry, Mark is King for Church Workers, Money Matters, and she calls herself a woman. This marriage must work. No more curses, loaded mouth, secrets of kingdom dominion, the exploits of service. Things fall apart. Church without bleeding pulpit, singles mingle, and many more.
Back from the break, and then we are still encouraging everyone out there to get vaccinated. Whether you are in Tamale, you are near our outreach centers, you are wherever you are in Ghana, in the world, get vaccinated. The Matter Inspires Foundation, in partnership with the Mastercard Foundation, is making sure that you out there is safe. Don't leave these things to chance. Get your children who are 16 years and above. Sometimes they may not even want to even take the effort to go and get vaccinated. But as a parent, once you are going to get vaccinated yourself, take your children along. If they are above 18 and you are busy, ask them to go and get vaccinated, and actually make sure that they have been vaccinated, because at the outreach centers, we saw some teenagers who were like, I'm afraid. So we just had to try to compel them to be like, oh, you relax, it's not painful, and get them vaccinated. So some of them might say, okay, I've gone to vaccinate, and they will actually not go to vaccinate. And when you are going for the booster or you are going for the second dose, make sure that you do not misplace your card. I think that we had that challenge there. Some people say, oh, I took the J&J, I'm coming back for the booster. Where is your card? Oh, it's been misplaced. So let me even come with you on that. What happens if someone misplaces his or her card?
Yes. No, we are dealing with a data. Ghana Health Service and Ministry of Health. After vaccination, we send the data to our IT department. They enter everything in the system, we call it DIMS. When they enter it, it goes straight to the regional health directories. They also submit it to the national directories.
Okay.
So anytime you misplace your card, unless you go to the district or the metro health directories, you mention your name. If you use your national ID card, whether the Ghana card or the voters ID card or the national health insurance card, you know, they have unique numbers.
Yeah.
So when they enter the number into the system, everything will pop up, your information will pop up, and they will give you a new card. But I think we always include that you should make sure that you have not misplaced that card, because at times it's very difficult to get your data back if the information is not yet sent. You know, we are dealing with human system. Who may do the data at the vaccination point and keep it for at least 1 month or 2 months.
Really?
So sometimes when you misplace it and the data is not yet submitted to the regional or the metro, you find it
difficult to get. So okay,
yes.
So I think the best, I think I did it, I'm not sure, is to take a picture.
Yes.
Front and back. So that even when you misplace your card, you can just get a card and fill in the details back when you go to the centers.
I think that would be very good. And secondly, we can also trace back to where you did the vaccination. You know, we have different points. You come to Kakpaile, you go to Blepela, you go to Nantonzo. If you trace to where you were vaccinated, they can give you the information. Okay. And now go to the regional and give you a new card. Okay. Yes, I think that's...
So when you misplace your card, that's not the end of the world. It's just that it's kind of stressful.
It's stressful.
Having to go around to the different centers to get your card. So like some of us, they just take a picture of your card.
Just a quick point. The vaccination, the card is very important than the shot.
Hey.
Because there's no evidence that you have taken the vaccine unless you provide the card. So if you think that, oh, the card is not important, I can do it, I can throw it away and go. No, the card is very important because that is the evidence document that you have to produce. Okay. That tells, or that makes you that makes sure that tells you that you have taken the vaccine. So I think it's very important that we should keep it very good.
Okay.
Or not.
Okay. I remember last night we're just watching TV and our prepaid meter went off, and for like almost 30 minutes, Kenny, right? We're looking everywhere for our prepaid card. Yes. And I'm like, but I usually put it here, I usually put it there. And we were all confused. Like, it took us 30 minutes to finally find it somewhere. So I think that, not to be like me, make sure that you have a point in your house where you put your card. So that, I think the best point, I have just kept it in my passport. So that in case you have to travel out, you have to travel anywhere, you're at the airport, you can just pick your vaccination card with your passport, with maybe your yellow fever card. I think even now, I don't even focus on the yellow fever than the COVID now. So make sure that these important documents are at one place, so you don't have to keep going around to now look for it, because it can always delay. Now, Kenny, for people that, of course, we are still on the campaign. We are still speaking on the campaign. There are people that sometimes you go to the communities that they kind of, should I say, not understand why we are making so much noise about this thing, even though they know that it's vaccination. But as somebody who is directly implementing the prayer on the grounds in the communities, why have we taken like World Cup? Why are we so serious about it? And why should they themselves even take it? Because they also have to carry the information we give them and go around. So what should the individual do when they see us in their communities?
Okay, so the first thing is that I would like to speak about my own personal experience with COVID. It was horrible. It was horrible. And I have an underlying health condition, which is asthma. So it means mine was ×2. I wasn't breathing. I kept thinking, what if I died out of ignorance? And I was like, oh, because I'm okay, it won't get me. I did take the vaccine, but I still felt like I should have taken the booster. But I felt like, oh, I was fine, I was okay. I got there and they asked me, have you taken the booster? I'm like, I didn't even know about it. And I did information care, I was like, oh, okay, that's good. So what we need you people to do when we go to the villages is that ask questions. Feel free to speak. Some of them are scared. Apparently, there's even a stigma to COVID. I didn't even know. There's a stigma. So they should know. They should feel comfortable. Talk to us. Ask questions. I mean, it was so funny on Saturday because I got a lot of them who are actually more afraid of the needle than the vaccine. Grown as men. Apart from even the young ones. For the young ones, I understand. But you, a 32-year-old man, you are afraid of needle. Look at me trying to convince you that it's just a needle. It's this big. They will choke it, bring it out, and that's all. The side effects are even much, much less because it's a Johnson & Johnson. So you don't have to be afraid that maybe something will happen. I remember when we took the first dose, all of us were sick.
I think I was lucky. I took the Johnson & Johnson. And so I didn't have a lot of side effects. I remember there was a time I was telling a friend that I just took it. And I took it on the 21st December because my birthday was on the 20th. And because of the misconception, I didn't want anything that would keep me in bed for my birthday. So the next day when I went to take it and I was telling people, they were like, oh, don't worry, you are yet to feel it. You fall sick. And at once, psychologically, I started feeling sick because of what they started saying. But later on, I was like, I'm fine. What are some of the side effects that possibly we should expect, and what is happening now?
I think the side effects are just minimal. We have fever, that's high temperature. We have cough. We have loss of appetite. And have difficulty in breathing. And these ones are mild signs and symptoms. But what I wanted Ghana Health Service or the government to do is that at least there should be some kind of motivation in taking the vaccine. Not giving money or cash to the one that you are going to vaccinate. Sometimes a lot of people will come to the facility with ADRs, that's adverse drug reactions. That's the side effects medically. When they come with these conditions, oh, I took COVID-19 vaccine and I have headache, I'm coughing, I'm finding it difficult to sleep. So how can we help? I think the government should take this cost when they come to health facilities. It will motivate them to come. Because if you come to the facility and tell them that you took COVID-19 vaccine and you have
side
headache,
effect.
you have cough.
Okay, slow down. So when people have side effects and they are reacting and they now come back now the drugs and things they have to buy, they have to pay for
They
it.
have to pay
But
for
if
it.
government can take that cost out,
Yes.
so that when they go for the review and their side effects, they don't have to pay anything.
Yes, that's what I wanted to. That's the point that I'm building. Yes, if government can do it that way, so that if they come to the health facilities with side effects, government should bear the cost. Otherwise, people say that after the vaccine, when you take it and you have these reactions,
Don't mind you.
they won't mind you. So it scare away a lot of people.
Yeah.
So I think if government can take those courses, it will help. And the other way around is that if we can also do it this way, like after 3 days, we'll revisit on the ground. To
Do we have
see.
enough health personnel for that?
Yes, we are trying to get a lot of people to buy into our products.
Okay.
So we have to sacrifice.
Yeah.
We have to sacrifice because we are trying to get a lot of, at least 90% of Ghanaians to be vaccinated. So we have to sacrifice, whether we have the personnel or not. We have to do the sacrifice. If we can work day and night, just to make sure that people,
everybody is.
Yes.
And I think that's what the campaign is about. So you'll be seeing us in your ghettos. You'll be seeing us at your internal, we call it base.
Yes.
So we'll be going there. I think yes, we'll be going there a few times. So every now and then, my team and I will be around. You see us pasting stickers on yellow buses. The information on our social media platforms are just going to be crazy. We are partnering with several radio stations, Kesmi FM, among the rest, our Soul Radio. We are just going to partner with them and just make sure that the information gets to you. You cannot miss getting this information. As for that one, whether you like it or not, you must hear about the public awareness campaign vaccination. You must hear about it. Whether on TV, whether on radio, whether on Facebook, on Twitter, on Instagram, we are going to be everywhere. And when you see that we post it on social media, I think that also about the campaign.
Yes.
Share it and tag as many friends as possible, because you might not know who would need that information. And some of you who can also read, when you are with your family who are not able to read, translate the information to the local dialect for them, because they are even the most important people that we have to reach.
Yes.
You go to a community, the last time I was trying to speak Dagbani, but I did my best.
Yeah.
But thankfully, we have volunteers in the communities who are able to translate. And we went, I think Nantonzo, the chief is literate.
Yes.
So he made it very easy for us, because he was able to listen to the exact words we said in English, and was able to also translate it himself to the local dialect for his people to really understand.
Yeah.
So there are those we are looking for. We will be, when I say everywhere, we are even going to be more than MTN. We are going to be everywhere, as in everywhere, because you know the Matter Inspires Foundation for over 7 years now. And anytime we bring you a project or something, it's big. So this is something that you have no choice than to support this campaign.
Yes.
Now, who is not qualified to vaccinate? I think now we know the first one, 15 years and below, you cannot vaccinate.
I think everybody.
For now,
It sounds
I think
fine,
first,
yes, apart from children from 0
to 15.
to 15 years. First, when the vaccine came, they said that pregnant women and nursing mothers were exempted. But as research continued to grow,
Okay.
they came out later on and said that they can also take the vaccine.
Okay.
So now pregnant women, nursing mothers, they can take it without any side effects on the.
So if you are pregnant or
Yes.
you are breastfeeding, you can take the
you
vaccine.
can take the vaccine. Without
You
any-
can take the vaccine. Or if you took the vaccine and you were not pregnant, and now you are pregnant, you can go for the
you can go for
booster.
yes.
You can go for the booster, and you're going to be safe. And I think I just want to add this as well. For children who are 15 years and below, in as much as you are unable to vaccinate, you have to even keep more of the protocols. You have to use sanitizer all the time.
Yes.
You have to wash your hands, have to wear the nose mask all the time, because that's even the point that your body is now growing.
Yes.
And you see, in as much as, it's funny, in as much as they cannot vaccinate, they can also contract the virus. I think there was this story about, I think a 5-year-old girl who got infected with COVID because the mother also had COVID. So I think that it's something that children, young people should really take note.
Let me make this quick important point. at first people were thinking that those with underlying conditions, that's hypertension, asthma,
Diabetes.
diabetes, and well, cancer, people were thinking that those people cannot take their vaccines. I think they are very, what do you call it? Important to take it,
Okay.
because of these underlying conditions, we call them
It can
comorbidities.
easily,
Yes,
Yeah.
yes. So I think they have to take it. They have to take it in the sense that when you are infected with COVID virus, it's already, your system is already down. Your immune system is already down. So when the virus gets into your body, into your system, it breaks down to the red blood cells and cause a lot of infections, and that will send you to your grave, early grave.
Wow.
So I think that it's very important for those underlying conditions to take it, especially those with high blood pressure, hypertension.
Does it have any age limit?
On-
Maybe like to take the vaccine, maybe after 60, after 70, after 80, 90-year-old.
No.
Once you are alive.
Once you are alive, you can take it. So far as there is life, you can take it.
I wanted to quickly add something very important concerning the campaign and the project that we are doing. We should always remember the hashtag. It's up
Yes,
to us.
yeah.
Correct for me, correct for you. Because I wouldn't bring you something that isn't good. So when you see us wearing these shirts, try as much as possible. Call us and ask questions. What's going on? What are you people doing? Because, I mean, we can't put all the information on the shirt.
Yeah.
But then you see us, you're like, oh, okay, those are the people doing the COVID-19. Yes. It should just click in your head. It should just be together that this is what we are doing. And we are trying to make life better for everybody. Because, I mean, I wouldn't be here right now if I wasn't smart enough to have done what I was supposed to do. So we should keep trying. Parents, talk to your children. Children, try and talk to your parents. Because it's like sometimes there's this breach of communication that nobody wants to talk to anybody. I keep looking and just expecting that the information will follow my head.
Yeah, but
No.
we should, the
We should
little you
speak.
know, create an enabling environment for conversations. Yes.
Yes.
And I think that's when we went to the second community on Saturday, and most people like the hashtag was like, correct for me, correct for you. And we say it's up to us because we have to take that responsibility to take the vaccine, to get vaccinated, to carry the information to you at your doorstep. And right now, what can we do? TV, radio, social media, gong beaters, information vans, one-on-one communication, debates, outreaches, anywhere going to, I'm looking forward for us to go to the bases. I can't wait for that. I remember there was a time I was just passing, you have very, what should I say, keen conversation because you go and meet them at the comfort of their homes or their base. So you get all the time to answer all the questions that they have. So it's up to us to make this decision. It's up to us to stay safe or get COVID and whatever happens will not happen. Because since it's correct for me, it should be correct
For you.
you. Let's go for a break. We'll be back. Welcome back. Just a few minutes to wrap up on this episode, and we are just reiterating that the focus of the campaign is not just to wear new shirts, walk around town and looking branded, but it's for us to actually make sure that you out there, you are vaccinated. It's also just to make sure that we are all safe, and we keep saying it's up to us. I think that I want you to just take the statement carefully and just say it. It's up to us as young people, as adults. Do we want to stay safe? It's up to you. It's up to me for us to achieve that. It's correct for me and it's also correct for you. If it wasn't, the World Health Organization will not be championing this cause. The Martha Inspires Foundation, in partnership with the Mastercard Foundation, will not also be championing this cause. So make sure that when you see us in your community, you come, you tell people to come. And I think that some people will be like, oh, I'm taking. No. A lot of us haven't taken our boosters because we feel like, oh, I've taken my first dose, my second dose, or those who took the J&J, oh, I've taken the vaccine. That is not enough. You need to go and get your booster because that is what is going to keep you more safe and more strong. So let me come to you about the vaccination. I think you ended on the fact that anybody can vaccinate except when you are 15 years and then below. And when you have underlying health condition, that's even when you have to take it, right? Okay, so let's give out our final words, the most important key words and key points that must go to our viewers.
I think I'll say for emphasize on Ghana Health Service and the government. The government should do a lot of effective communication
Okay.
on the vaccine. There are a lot of myths, there are a lot of beliefs that the vaccine is not good for people. Our communities leaders should also encourage their people, especially the men. In other part of Ghana, especially Tamale, a woman has no choice.
Yeah.
If you are going to take a vaccine, you have to go to your husband.
Your husband.
Take
Hey.
permission from the husband before you go for a vaccine.
Say that again. Before a woman can take a COVID-19 vaccine, the husband has to approve.
Before.
That's what we are facing here. That's the reality. Not just because we are on TV.
Yes.
That is the reality. That your husband has to confirm. And even if he doesn't, and you take it without, and he's not in support, and he gets to find out, it can cause a divorce.
Yeah, because it's a big problem.
It's a very, very big problem. And at times, we have to go in and beg and convince the husband that this is not family planning. So
They think that it's a family planning method.
Yes.
I just think that government is trying to reduce childbirth. For men, they think that they are strong. Nothing can happen to them. But the women are willing to do it. So if a woman comes and without her husband's permission, it causes a lot of problem in the house.
At the point you said something they feel is family planning.
They think that it's family planning. So when you take it without your husband's consent,
you can't get pregnant.
Yes.
And also because of the misconception that you can't get pregnant, they think that the government is trying to reduce
the population.
So I think a lot of communication, effective communication has to be done. Health education with the opinion leaders. We have to involve the organizations, the chiefs,
allergies, the pastors as well.
Pastors, the imams, the zachis, the youth chiefs, we have to involve them. Let them understand that COVID-19 is real, and the vaccine is the surest way to protect you from getting the vaccine, the virus. So I think government have to also calm down with communication. You have to involve the local chiefs, so that if they speak, I think that one will help them.
The chiefs, every opinion leader should be able to understand the concepts of this.
And besides that, the youth must take this course. Because we are the productive age. The old men are going.
They are going.
They are going to be in the system. So we have to protect ourselves from COVID-19 so that at least we will end up living up to
the age of potential.
Yes.
This is serious. I remember a few years ago, I worked with another organization on a project on family planning method, adolescent reproductive health. And we face the same challenge. You cannot give a family planning pill or an injection to a woman without her husband's consent. And there are times, like you said, we have to go and beg the husbands that, oh, we are sorry. So even when they are even sick and they are coming to the hospital, they want to even get a normal malaria injection, they have to tell their husbands that I'm going to take a malaria injection. I just hope that we get to the point as Ghanaians, as Northerners, as people from Upper East, Upper West, Northeast, we need to get to the point where we don't think that every injection is family planning. Yes, I think that we think that every injection is family planning. COVID is here. We need to take it out from us. We need to make sure that no one in our family gets infected, because until you actually know someone who is infected, you think that is far from you. Kenny, finally, the campaign. I know you're talking about what to expect. What more are we going to do that we haven't said? What more are we going to do?
We are going to be communicating with you. We are going to be dancing with you. We are going to be singing and drumming it in your head. Please take the vaccinations. I know, we all know, we've spoken about it in low tones, about how people have actually died from the vaccine. there has been
But
a lot of issues.
it hasn't been, you see, like sometimes there can be other issues.
Yes.
It is not the vaccine
itself
that's
killing.
Yes.
I mean, sometimes it got to a point I was also very scared because I'll see a lot of things on Twitter. You see a lot of things on
someone
Facebook.
took it and
Somebody
died.
took it and died. Somebody this one. So I was like, when I got COVID, it was like, oh no, it's not a joke anymore. It's serious. And now the youth, we shouldn't just be hashtagging "is the hair for me." Hashtag is up to us.
Yeah.
Hashtag correct for me, correct for you. Because I mean, what's the entire purpose? If the youths are dying, and what are we going to do? Who is going to lead us into the future?
Yeah.
We have to be safe.
Yeah.
And please, for the men out there, it does not cause erectile dysfunction. We are begging you.
And the women out there who want to conceive,
You can conceive.
you can conceive after taking the vaccine.
Yeah.
And those who want to expect their menstrual flow, you can still menstruate
Yes.
when you
want
like
to or when you're supposed to.
Yes. It does not cause anything. So we are coming to you. The Martha Inspires Foundation's team is coming to you. Martha Inspires Foundation, in partnership with the Mastercard Foundation, we are coming to your doorstep. As for me, you've been seeing me all the time. I'm going to be on TV, I'm going to be on radio. Even without this episode, other episodes on the Reflection Show, I'm going to mention get vaccinated, get vaccinated, get vaccinated. We need to get to the point that everybody gets vaccinated. And as soon as your child gets 16 years, some of them, I think this thing came when they were 14 or 15, so they couldn't vaccinate. As soon as they are 16, 17 years, go and get them to vaccinate.
It is free.
It's free, yes, it's free. You don't have to pay anything to get it.
Whether you have any national ID card, whether you have Ghana card, national health insurance, or
Voters ID.
you can just come and take it.
And get
It's free.
vaccinated. And the most important thing, keep your card safe.
Yes.
After you get vaccinated, keep your card safe. Take a picture of your card, put it on Google Drive so that at any point you can just go back to it and refer to it, and you can get your booster. So we are coming. Get your booster, get vaccinated, read more about COVID as well, so that someone will not come and tell you that, if you take it, this will happen to you. No, it's not true. Thank you so much for watching this episode on the Reflection Show. Keep following us on all our social media handles, Martha Inspires Foundation, Martha Inspires GH_Foundation, I think on Instagram or so. Our social media managers are going to make sure that every single day there is something. And our influencers, Ibrahim Mustafa, Arinsian, Korani Kakraba, and even our other influencers are all going to make sure that this information gets to you wherever you are in this country, in Tamale, in Upper East. Look, you'll be tired of us. Anytime you even see the shirt, now you're like, these people are coming. Yes, because we want to make sure that you are safe and you are strong and you are healthy. My name is Martha Annabila. Thank you very much for watching the Reflection Show. Do have a good night.